Welcome to the other side of Letby. In episode 19, we're going to start on the tragic fate of baby D. And we'll start with the prosecution opening statement that demonstrates for me, as a former professional doctor, just how fantastical these descriptions are and just how inappropriate the terminology is when describing these events in prosecution opening statements. So it says, background, baby D was a baby girl born at full term, that is, she was not premature. So straight away, we should expect that baby D, mother went into that hospital, had her baby and went home. That would be the general expectation of a baby. The court hears there is a valid criticism for the hospital, as the mother should have been given antibiotics to stave off infection after her waters broke early, but she was not. So this is the only valid criticism of this hospital from this opening statement, when it's very, very far from the only valid criticism. Although born healthy, baby D lost colour and became floppy in her father's arms. And in her father's arms is an important part of this opening statement, because in Dr. Bullen's testimony, she goes on effectively to assign the blame to the father for the loss of colour and becoming floppy, as we will see at the time when we're looking at that analysis. So straight away, the jury is being told that this baby lost colour and became floppy in her father's arms. Just leave that in their mind there. She was put under observation as she was showing signs of respiratory distress by grunting, and her temperature dropped. So, although born healthy, being held in her father's arms is now brought on respiratory distress, grunting, and her temperature dropping. Why is a full-term baby's temperature dropping? Baby D was admitted to room 1 in the neonatal unit, placed into an incubator and given oxygen therapy and antibiotics. Well, baby D was admitted to room 1 in the neonatal unit about 3 or 4 hours later than she should have been. And the mother had to beg for that to happen. She developed a very high temperature and a rise in her heart rate. So what the heck has that got to do with her father holding her in her arms? A baby with a very high temperature and a very high heart rate is a baby with very severe problems, more than likely sepsis. And then she was intubated and ventilated. So why does a healthy birth require intubation and ventilation? And why does it require this within hours of the birth? She improved significantly, it goes on, but was still affected by her infection. So now she has an infection, but she's improving significantly. But where did she get the infection from? She's only 4 hours old. In my opinion, there's a high likelihood that poor baby D acquired its infection in utero, and did so because of the filthy conditions in this hospital. And then the prosecutor goes on to say that baby D had catheters inserted and the levels of infection dropped. Well, the levels of infection dropped so much that they were recorded on the post-mortem as a cause of death. That's how much the levels of infection dropped. And then Mr. Johnson crowns it all off by saying, all good signs. For a doctor reading this stuff, it's just absolutely stunning. But I think the most interesting, and really I think it should be mandatory reading for every medical student and every nursing student, and it's the mother's statement. So we're going to go through the mother's statement, and in my opinion, of read and weep. So the prosecution, led by Nicholas Johnson KC, asked Baby D's mother to confirm details. Baby D's mother tells the court she developed a concern about her waters breaking, which the court hears was well-founded, as her waters broke when she woke up on June the 18th. Now, we keep that date in mind. The hospital told her to monitor the situation. She waited and rang the hospital again and was then told to go to the hospital. At 11:30 a.m, she arrived at hospital and staff confirmed her waters had broken. Then they checked her and her baby, but according to the mother, not for very long. Were you in effect sent home after being examined? So that's the prosecutor's question. Were you in effect sent home? So the implication here is there was no need to do anything for this mother. You know, she was sent home after the examination, which the mother said wasn't too long. And the mother confirms that yes, she was in effect sent home. The following day, the mother returned to the hospital and saw a midwife. Were you examined and various checks performed on you? Probably not. I mean, I think, did the mother just go to see a midwife, maybe to play a game of checkers? What would we expect? That examinations and various checks would be performed by a midwife on a woman who's at term in her labour and has premature rupture of membranes, because we have no activity on the labour front so far. And the mother replies, yes, not straight away. I had to wait. Did you express concern to the staff at the contest? So again, what do we think? She's already told us she woke up on the 18th and she's worried. It's now the 20th. Do you think she's less worried, that she's going to express less concern? The mum said her waters had broken over 24 hours before and she didn't feel right. And the baby didn't seem to move as well. And that's one of the things that a doctor or a midwife absolutely hates to hear, because mothers develop this sense of the movement, the personality, the being of the baby long before it's born. And after it's born, most mothers that I've ever met could pick out the finest detail on that baby's skin and point it out to you. So this ancient biological gift to humanity of motherhood is not an empty state of being. It's an incredible example of the ability of human beings to bond. And then she said she was concerned with this lack of movement, and she was concerned about infection, as she hadn't been given any antibiotics. The decision was then taken to induce her. So on the 2 visits to the neonatal unit, midwives and people who examined the lady, they were so worried, they were so conscientious and on the ball that they didn't suggest to her any antibiotics. I think it's very unlikely that the mother didn't suggest to them that she be put on antibiotics, because that was her first thought when she woke up on the 18th. So they made a decision now to induce. So what that means is they're going to use one of varying methods to try and hurry along a natural delivery. And the mum went on to say that staff were very busy and she was placed on an IV, but not for many hours. It was very delayed, the mother tells the court. The mother said she was very worried and scared, unwell and not in control, and forgotten by the staff. And it was nearly 48 hours now after her waters had broken. On a trip to the bathroom, she noted blood had come out. She asked someone to do something. She doesn't say she asked a nurse or she asked a doctor or she asked someone whose job it was to do something. It said she asked someone. So, this is another patient on the ward. She said she remembered seeing a doctor and recalled a description of her. That's the doctor. It was the first time she had seen a doctor since her admission. She was told that essentially both her and her baby girl were okay. Okay not being a medical term, but there we go. A natural birth would be considered, and that would be reviewed 4 hours after at 11 a.m. At 11 a.m, the mother was assessed again by a different doctor. She recalls a description of the male doctor. She was told there had been little progress, and she said that he was the first professional who spoke to me and addressed my concerns. And this is the bit that medical students, nursing students, and all of us that practice medicine should be learning. We have to address the concerns as professionals of the people in front of us. It doesn't matter whether you have 100 other patients waiting, you have one in front of you. And your duty is to that one in front of you. The mother said, she goes on, that it had been now 50 hours since the waters had broken, and a C-section was considered as there had been no progression of the labour. The mother was informed a natural birth would be preferred to a caesarean section. Well, of course a natural birth would be preferred as an option to a caesarean section. But we have to deal with the person that's in front of us. Not a protocol book or some advice somebody gave you somewhere along the line or some low quality evidence that you need to avoid caesarean sections. No, we have to deal with what is in front of us. By 3 p.m, we're really rocking on here, aren't we? The mother had discussed the situation with her husband and concluded she would be less patient and called for caesarean section, as there had been no progress. So the mother, desperate to get the baby out because she knows that things are not right, wants a caesarean section done. So at 3 p.m, the mother was reviewed by the same male doctor, and he was more concerned about the situation as he appeared more tense. The doctor confirmed she would receive a caesarean section, as he said it was not a good idea to wait any longer, as the baby appeared distressed. So the baby appears distressed on an examination in utero before birth, confirming the mother's fear for the change in movement pattern in the baby, and confirming the mother's fear of infection before birth. The mother goes on to say that events were moved on a lot more quickly, that staff had initially appeared chilled. After the C-section decision was made, matters moved a lot more quickly. Baby D was delivered and lifted over the screen for the mother to see. So all of us who have been in delivery rooms, we know what that involves. Stimulating the baby, swaddling the baby, and handing it over to the mum as soon as you can. And sometimes when the baby is born, people will show the mother the baby as they're delivering it by caesarean section, even if it's only briefly. But the mother recalls, and I believe every word of this because mothers know. Mother recalls seeing no life, lifeless. She did not scream. Everything was quiet in that room. Mr. Johnson asks if there was a nurse in the theatre room at this stage, and the mother does not recall. Was Mr. Johnson asking if there was a neonatal nurse? in the room at this stage because there would have been a lot of other nurses. I think that means specifically a neonatal nurse. But it also means, and I can't find any evidence in the public record, that there wasn't a doctor present at this delivery. So, in spite of the fact that we knew that we couldn't afford to wait any longer, and the situation was getting worse in utero, and the examining doctor had said that the baby appeared distressed, there was no doctor there to resuscitate the baby should it need resuscitation. Mother goes on to say that she was taken to a ward while medical professionals dealt with baby D. The mother recalls seeing baby D very briefly in the operating theatre before the staff took her away, as they had concerns. And we will see what concerns they had later on. The mother said she was very aware of things going on despite having received an anaesthetic. She did not have physical contact with baby D, but her husband had. The mother was taken to a ward. The mother was taken then to a further room, and it was there that she had physical contact with baby D. Her impression of baby D's condition at that point was really worried, as she was brought to my chest, but she didn't have any movement. She looked limp and pale, struggling to breathe and making a groaning noise. She really wasn't very responsive. There was a split second when she opened her eyes and looked at me, and then no response. I tried to breastfeed her, but she was completely limp, so I was worried. Male paediatrician informed the mother not to worry, as the delivery had been through cesarean section, so the breathing wasn't as clear. The mother said she didn't believe what he said. His attitude seemed too careless. The mother said she thought something was wrong with baby D, and one of the midwives would assess her in a couple of hours, so another couple of hours, given the mother's description of a baby in great distress immediately after birth. She said she did not want to wait that long and wanted another doctor's opinion. The same doctor came back, but he had spoken to a consultant. Well, the consultant didn't come back. The same doctor came back. It's this kind of recurrent theme of spot the consultant in this unit. The mother said she was not reassured, but was glad someone took me seriously. And again, what can you say to that? She was then worried that baby D was taken straight to a neonatal unit intensive care. The mother said she felt like rubbish, drained, and didn't feel any relief, and she was in pain and knackered. And of course she was. She'd been through 2 or 3 days of incredible stress and anxiety and worry and attempt to leave her and an operation. The mother said it was around 7 or 8 o'clock when she was separated from baby D. And she uses that word, separated, because when mothers have their babies, they are not separate from them. They're part of them. And that separation, again, would have been a terrible blow to that mother. The following day was Father's Day. The mother was given news that baby D had been up and down all night, struggling with feeding, and staff didn't seem too concerned then. But baby D wasn't great. So I don't know who used the word wasn't great, but the mother used it, that the baby'd been up and down all night and she wasn't great. And again, I asked the question, why is a baby having such a catastrophic 24 hours after birth? And with the prosecution saying that this was born a healthy baby and that these expert witnesses will go on ad nauseam to say that this baby was a stable baby. This baby was anything but a stable baby. The mother believed she had been spoken to by a female consultant doctor that morning. The mother said she recalled baby D needing to be put on a CPAP machine, and every time they tried to take her off, she would crash. Staff did not seem overly concerned, as baby D was a good-sized baby and making progress despite being poorly. What do you say? Other tests showed she seemed fine. The mother said she was able to see baby D at about 7 p.m. that day, so 24 hours after they separated her, up and down all night. I will get to all of this later. The mother said she had spoken to a doctor before heading to the neonatal unit. A drawing that the mother had made showed a plan of a neonatal unit room. Again, we're down into the weeds about all of this stuff. Baby D's mother said she had spoken to Dr. Andrew Brunton at 9 to 9:30. She was told he was very happy with baby D's test results. So we're treating test results now. We're not treating babies. We're not treating mothers. We're treating test results. They had done more scans and she was well and promised her she would be able to hold and cuddle her the following day. So it's a term baby. It's 2 days since the baby has been born and the mother can't hold her. But she's in good condition. The mother said she was not in a good condition herself, being moved to a wheelchair and was in a lot of pain and was taking morphine. But she was happy with baby D. Baby D looked like a good pig baby, tiny but chubby and looked healthy. The next time she saw Dr. Brunton was the following night. She and her husband were woken up about 4 a.m. by a nurse to come quickly as baby D was poorly. They rushed downstairs and Dr. Brunton was holding her and trying really hard to resuscitate her. We were just standing there looking at baby D dying. And I suggest to medical students and nurses who may ever hear this, that is never a position you want to be in. And you should be doing everything in your knowledge, power and capability to avoid this avoidable situation. The doctor was quite agitated when the mother was on, and the couple heard they had to let baby D go. They had to let baby D die within days of being born, a term baby. The mother, she couldn't stay there anymore and asked to be taken away. A nurse who the mother believed to be Lucy Letby was holding a phone to Dr. Brunton's ear, she recalled. And we'll hear more about that. The mother says she had seen Lucy Letby before when she went to see baby D in the neonatal unit at 7 p.m. So it couldn't have been 7 p.m. because Letby wasn't there at 7 p.m. It must have been slightly later than that. The mother recalls, as she was wheeled into the room, that Lucy Letby was hovering around not doing much with baby D and had a clipboard and was looking at the machinery. And this is Lucy Letby coming on to her shift and doing her mandatory checking of the machinery. I didn't understand what she was doing, and the mother asked if baby D was fine, to which Lucy Letby said she was. Now, Lucy Letby has just given the infamous handovers. Didn't have any reason to believe that she wasn't well because all the doctors said she was doing fine. The mother goes on to say Lucy Letby just stuck around and was just watching, looking over us. And then the mother goes on to say that she asked for Lucy Letby to just go away and leave us in privacy. So this must have been after the baby's death. I once witnessed a mother throw a fire extinguisher at a midwife when she went to tell her. So just telling a midwife to go away and leave us in privacy is a perfectly human reaction. Mr. Johnson asked if Lucy Letby was in the neonatal unit room at the time baby D died. The mother agrees and says that other doctors were in the room. The mother recalls she was taken to a private room where baby D was, along with her husband and other family members, and a nurse she had not seen before. The mother says she did not see Lucy Letby again. And then Ben Myers comes in with this cross-examination. For the defence, he's now asking more questions. Mr. Myers says it's an awful experience what the mother went through. Well, that's putting it mildly, and says he has one or two questions to ask. He asked about the 7 p.m. neonatal unit visit on June the 21st. The mother says she went there with her husband. She recalls 7 p.m. and she must have looked at her clock. She said there was an exchange of a few words between her and Lucy Letby. I don't know what this has got to do with anything, but it's in the evidence. Mr. Myers asks if it was possibly another nurse, and the mother replies, I don't think so. So the mother doesn't know. The judge, Mr. Justice Goss, asks for clarification. The mother says she would not have known the name of Lucy Letby at the time, but would after seeing her picture when she had been arrested. And that's the end of the mother's statement. That mother's statement to me isn't angry enough, but it is accurate enough. And I think it's pretty chilling. And I would hate to have worked in a place like this where the few minutes that you can spend sitting on a bed, holding a hand, explaining things the best way you can, really, really simple things that don't require scans and tests and x-rays and probing and things and mucking about with things. It just requires affording the dignity to a patient that every patient is entitled to. So we're going to get on in the next episode with some of what I consider to be the most ridiculous medical evidence I've heard in this trial, particularly from the expert witnesses. I don't believe half of what I'm reading, and I hope it's not down to the court reporter, which I have no reason to doubt his ability. So in episode 20, we're going to carry on with baby D, and I haven't decided yet, but we might need to break up the sequence of the evidence that is given to get a better picture of what was really happening. So I'll see you then.